Hello, this is the second part of the talk on Mirena Coil, which is a form of contraception for ladies. We have spoken about the reliability of the Mirena Coil. I'll be talking a little bit more about the advantages. We have spoken about how long Mirena can stay in. For most ladies, they actually have it in for a period of 5 years. For ladies who suffer from heavy periods, Mirena is known to make your period lighter. And that means you bleed for less days and the flow is lighter than normal for you. A lot of women who cannot use other contraceptives because of other medical problems are actually free and safe to use the Mirena. It is safe for people who suffer from migraines, people who are obese, and people who have high blood pressure. Mirena does not affect your fertility or your ability to conceive on a long-term basis. Most people who would normally have gotten pregnant, if they have Mirena in place, can fall pregnant within 1 month of having the Mirena taken out. How does the Mirena get inserted? The Mirena gets put into the womb just by you assuming the same position you assume when having sex. It is advisable that the Mirena coil is put in within the first 7 days of your cycle. This ensures that you get all the protection that you can get within that time frame. If you have the Mirena coil inserted, after 7 days from the start of your cycle, you will need to use another form of contraception until the next 7 days. One of the questions that's been asked is, are there any complications with the use of Mirena? A few people may develop an infection after the coil has been inserted. To minimize the risk of this, you need to make sure that it is being done by a professional who has been trained and is qualified to do so. Part of the training is to make sure that the procedure is done in a very clean, otherwise sterile environment. This will ensure that they observe very strict hygiene. Also, some people have had perforation of the womb or internal organs. This is extremely rare, and the likelihood of this happening is reduced if it is done by a professional who is trained to do so. The Mirena can get missing and it can move from place to place. In this rare occurrence, your doctor may not be able to see the thread again, and they can use a scan to search for it. If your period that has been very light whilst you've had the Mirena coil starts to get very heavy again, when you believe that the Mirena coil is still there, you need to see your doctor as soon as possible so they can carry out a coil check. One of the questions we've asked is, will the thread pinch or hurt my husband during intercourse? The answer is no. Most men are not able to feel the thread of the coil, not only because it is